So we're living in a different world now, and the landscape of how people deliver therapy is also changing. You may have noticed that therapists and other healthcare providers have switched over to telemedicine, teletherapy, and a lot of folks have questions about that. The first question people usually have is, does it work? Isn't it weird to not be in a room with someone? And the short answer to that is that there have been research studies over the last several decades, actually, that show that teletherapy is as effective. There are similar outcomes with teletherapy as for in-person sessions. So yeah, it does work. And the more you do it, the more comfortable you get with it. Another question is it safe? Is my information protected? Well, as long as you're meeting with a therapist that is using a HIPAA-compliant platform, which we are, then yes, your information is safe. Another question is about the technology. Sometimes people will say, well, I don't know technology. I'm going to get confused. It's not going to work. It's actually super simple. It really comes down to a click of a button, and you can do teletherapy from a smartphone, from a tablet, from a computer. And, we have contingencies in place should we lose connection. But the technology, I'm finding, is not the obstacle. The only obstacle that tends to show up is whether or not you're able to find a quiet, private place. So distractions don't come in and distract you away from the session. And for the most part, people are able to do that. And there are some situations where it's hard to find that. And we've been able to find real creative solutions. So let's take that barrier out of the way. And if you have questions about teletherapy, please go ahead and give me a call. And I'm happy to do a little test session to see if you feel comfortable with it. All right, I'll talk to you soon.